What is a mitral valve prolapse, and how is that then related to overall valve disease?
Mitral valve prolapse is when the valve tissue was redundant and buckles back. So again, imagine that swinging door, and if one door was sort of bigger than the other and they didn't meet together, so it creates a gap in the two doors and blood will flow between them. So you'll see this one leaflet will buckle backwards and blood will come back through it, and that's mitral valve prolapse. For the most part, mitral valve prolapse without severe regurgitation is a benign disease, where there's redundant tissue, but the leaflets close, and again, using the doorway analogy, the doors touch and close, and there's not a lot of leakage. Mitral valve prolapse, where the leaflets leak a lot, is the disease that we need to treat, and that we're sort of talking about today, where that would require an intervention if the patient is symptomatic.
So is there a difference in symptoms between aortic stenosis and mitral regurgitation?
Patients with aortic stenosis will commonly have symptoms which include chest pain and passing out and shortness of breath. Patients with mitral regurgitation more commonly will have shortness of breath and exercise intolerance if they have severe mitral regurgitation.
So then we've talked about the treatment. Again, let's get back to treating the condition. How do you then decide how to treat this?
Well, it depends on the patient's age and how severe their symptoms are. So again, in a young patient who comes in with severe leaking of the valve, patients may want to be treated more aggressively to prevent the problems of the natural history of the disease. Again, that's what we're always trying to prevent when the disease will get, what would happen if we do nothing. So if we do nothing to patients that have severe leaking of the mitral valve, the heart wears out with time. It will enlarge and it will slowly start pumping more weakly, and the patients will become more short of breath. And even if they're minimally symptomatic, a weak heart, when we try to fix that valve later, if their heart is already weak, the heart will actually get weaker after the surgery. So we try to get those patients earlier now. So a younger patient with lower risk for surgery, many people are recommending to fix the valve with no symptoms. For older patients where the risk is higher, it has to be individualized, and at the very least, we want to treat the patient when they're starting to experience early symptoms or mild weakness, or the heart shows its first signs of weakness, to fix that valve then. But usually the earlier the better to fix the valve. And so the first sign of symptoms, we want to fix the valve.